Life is full of awesome what-ifs, and some not so much, like unexpected medical costs. That's why United Healthcare provides Health Protector Guard fixed indemnity insurance plans to supplement your primary plan and help manage out-of-pocket costs. Learn more at uh1.com.
Many of us have those stubborn pounds that seem impossible to lose, no matter how good we eat or how hard we work out. My solution is PlushCare. PlushCare is a leading telehealth provider with doctors who are there for you day and night to partner with you in your weight loss journey. They can prescribe FDA-approved weight loss medications like Wegovy and Zepbound for those who qualify. Plus, they accept most insurance plans. To get started, visit plushcare.com/weightloss. That's plushcare.com/weightloss.
Need new glasses or want a fresh new style? Warby Parker has you covered. Glasses start at just $95, including anti-reflective, scratch-resistant prescription lenses that block 100% of UV rays. Every frame's designed in-house with a huge selection of styles for every face shape. And with Warby Parker's free home try-on program, you can order 5 pairs to try at home for free. Shipping is free both ways, too. Go to warbyparker.com/covered to try 5 pairs of frames at home for free. warbyparker.com/covered.
A Child's Guide to Integrated Care Systems. I love it.
Welcome to the Power Test. I'm Ayesha Hazarika.
And I'm Sam Freedman. Welcome to the Power Test. Ayesha, where were you when you heard there was going to be a general election?
I was attending my first and only meeting of the Labour Lords group.
A very brief time in the Lords.
A very brief appearance at this meeting. So I had been presenting on Times Radio all afternoon. At 1 o'clock, I was sort of, there are all these rumours swirling around Westminster that Rishi Sunak's going to call a snap election. Don't be ridiculous. There's no way Rishi Sunak's going to cut. And then as the afternoon ground on, I'll tell you, it was the tweet that suddenly made us all stop laughing and go like, shit. It was not even the stuff about the podium. I think it was Adam Bolton or somebody tweeted that David Cameron had been sort of yanked back home from some sort of foreign trip. And then everybody was like, oh my God. That's where I was. And it was just an absolute shock because I only got introduced to the Lords like 2 weeks ago. I was hoping to have a, decent amount of time before the election. And on a very selfish level, it's been carnage for me, Sam, because I had to make my maiden speech on the last day that this Parliament was sitting.
And I'm not just saying, it was a very good maiden speech. You actually kept most of the Lords around you awake, so that is pretty good for the House of Lords.
Well, how did news reach you?
I was in Stoke in a school at a board meeting of a charity that I'm on the board of. The rumours started coming through in the morning and I was trying to keep focused on this board meeting and completely distracted. And when I realised it was probably going to be true was when, and it was Tim Shipman, who is probably one of the best connected journalists in Westminster, tweeted late morning that none of his contacts were denying it and that had not been true of any of the other times there'd been a rumour about the election. And I thought, oh shit, it's happening. And likewise, I've had to rip up all my plans.
I would just say, I feel that the amount of anger that has been caused by this snap election, like whether you're an MP, whether you're a journalist, whatever you do, I feel like this is Rishi's final act of revenge. He's like, you bastards have been slacking me off all this time, so I'm going to ruin your lives for the summer.
Between, we desperately needed an election, right? For the good of the country, this is good that it's happening now and we're not waiting another 6 months. But they could have given us a bit of warning. I mean, it's just like
totally
telling everybody it's going to be in the autumn, essentially, and then deciding to do it. And he surprised his own party more than anybody else.
Well, I was just about to say that. I mean, the whole thing about an ambush is you're meant to ambush the other side, not your own side. Also, it's like a rule in British politics. You do not go on Loose Women and say, book your holiday.
It's amazing how he caught everyone off guard, despite the fact we knew an election was coming pretty soon. And that's been very visible, I think, in the Tory campaign, which has been pretty shambolic so far.
Yeah, it's sort of been like a piece of performance art, hasn't it? From the beginning with the launch in the sopping wet rain to all these disastrous photocalls. At one point I was going to write a book called How to Lose an Election, and this would actually be the kind of template for it.
Yeah, and there is, I think, a small risk for Labour. I will only say small because I think they're absolutely on track for a whacking majority, is that they say so little in their campaign that eventually when the Tories stop sabotaging themselves, if they manage to do that at some point, you're going to get lots of other distractions starting to come up just because they're not giving the journalists who are sort of following the Labour campaign any crunchy policy to talk about. Today they were talking a bit about the NHS, which is what this episode is going to focus on. But even that is sort of saying we're going to get waiting list down without any sort of real plan as to how they're going to do that. There's a risk of being so disciplined and saying so little that you create a bit of a vacuum.
Yes, although having been very disciplined, it is fair to say that as we record this, the row over Diane Abbott has overshadowed.
This is a good example, right? Exactly.
I spoke with John Curtis earlier, and he was kind of saying, in a way, because not much actually moves polls in short campaigns, in a way, I think we're probably in a holding pattern now, aren't we? I think Labour is going to be very disciplined and hold things back until the manifesto. I suppose what will be interesting, Sam, is are we going to have like a splurge of exciting policy news when the manifesto is announced? Or do you think we should actually prepare ourselves for quite a muted manifesto?
Well, I mean, Rachel Reeves has said this week that she's not going to be making any more announcements on tax. So there's not going to be any more tax increases. Without that, it's very hard to see how they can afford to do anything really crunchy in terms of new policy announcements. They'll have to have something in there that hasn't been sort of announced already. But it's hard to see how it's going to really capture the public imagination, given that there's not going to be any more money beyond what has already been sort of allocated to various policies.
Is there a world in which, Sam, you can imagine, given that people are really cynical about politics, given that people know that there is not a lot of money around and that even if Labour wins with a massive landslide, it's going to be really hard to turn things around, is there quite a cynical argument to literally just do like the thinnest manifesto ever and hardly put anything in it, on the basis that most people don't really read a manifesto and a lot of people don't even believe a manifesto? I mean, you look at something like the Rwanda scheme, that wasn't even in the last Conservative manifesto. Could we move into a sort of almost like a post-manifesto world where you don't actually need to do a manifesto?
I think we are going to get almost that. I mean, they will have one, but I think it will be very thin. And I think the Tory one will be pretty thin as well. And assuming they do win and win well, potentially with a big majority, that gives them a very blank page to do kind of whatever, but also no mandate to do any of those things. So it's going to be a very odd situation.
So we're discussing health today, Sam, because that's one of the key pledges for Keir Starmer. It's interesting that they've kicked off early with health. What are your thoughts on the kind of sort of strategic comms of doing health now? Well,
health is their strongest card. They lead on it by 40% in the party, massively. It's their biggest lead on any issue. People expect them to talk about it. In a way, there's almost no more votes to win on it because they're already so far ahead of that on that issue. So I think in a way that's kind of why they're doing it early. I suspect they're going to focus later on in the campaign on a lot of issues they're less closely identified with as a way of showing that they can be trusted on defence, migration, etc. Because that's really the core of this campaign is to chase those disappointed Tory voters. So I'm not surprised they're doing it early, not really surprised by the kind of things they're talking about. But you sort of made the point just now about trust in politics. It just doesn't feel very credible to me to stand up and say we're going to get down waiting lists without any kind of plan to do it. So they're just resting on the fact that people think they're better on health anyway, so they don't need to have a kind of worked out plan for doing so.
Yeah, I mean, they're smart to focus on the waiting list because that is, of course, the sort of everyday thing that people are really, really worried about. But there are a lot of really difficult things waiting for them, you know, in that first 100 days, whether it's more industrial action, whether it's how you're actually going to make this stuff work. How can you just magic up staff to do these extra hours that they want? So yeah, again, a lot of this is going to be trust us for the time being, and then there'll be a lot of pressure on them to deliver quite quickly. So we're going to get into the guts of Labour's health pledge. You've got two expert guests. We're going to be speaking with Sarah Woolnough from the King's Fund, and later we'll be speaking with Matthew Taylor from the NHS Confederation.
Sarah, we've seen Labour starting to talk a bit more about health in the election campaign, talking about how they want to essentially bring the waiting list right back down to where it should be by the end of the Parliament. I'm going to ask you an impossible question to start with. Is it possible to do that? Can they bring it back down again? And what would it take to do that?
I think the short answer is, I think it's possible. It would be hard to do so. And history tells us that getting the waiting list down, as a previous Labour government did, took a decade, took an almighty effort across a whole range of levers. So what we're hearing from Labour today, I think, taps into public concern. A couple of months ago, we had the British Social Attitudes, lowest ever recorded satisfaction with the NHS at 24%. We described the service as being in uncharted territory in terms of low public satisfaction. So it's tapping into something the public really care about. I think to do it over a single parliament is really ambitious, and it will be tough.
So Wes Streeting has talked about using capacity in private hospitals, which to my understanding we already use quite a lot of. And they've talked about putting a little bit of extra money in to get, the thing that's on their pledge card this time, which is 40,000 more appointments a week. That's not going to be enough by itself, is it?
Well, they're talking about extra staff. It's 40,000 extra appointments a week is money to pay staff to deliver that. There is also a bit of money for extra equipment, so scanners, MRI and CT scanners, which will be very welcome because we relatively have low numbers of kit. And they are talking about using the extra appointments in the evenings and at weekends. Some hospitals, some providers are already doing this, running hit lists or super Saturdays or providing additional capacity wraparound. What history showed us is you need all of this and more. So you need a very strong commitment from the centre that permeates different levers across the health and care system to make this happen. And to make it happen quickly is going to be tough because you'll essentially be asking many, many providers to make this their guiding star, their absolute priority for a number of years, which squeezes out an ability to do other things.
And is there one thing that Labour could say that would make you think, yes, they've got this, they understand what it's going to take to do this very hard thing over a single parliament?
Well, I suppose I would look to perhaps what they're not discussing today. As an example, we have an 11.6 billion maintenance backlog. So we know we've got crumbling estates, and that is often a rate limiting step for ramping up activity. They are saying they'll do several things. So more money for staff, max out private sector capacity if necessary, although there isn't that much more to go at for the reasons you say. Ensure this is a priority across the system. There are other things at play. So estates, crumbling buildings, maintenance backlog is a rate limiting step. Similarly, I think the staffing issue is a sort of harder nut to crack than perhaps today's statement gives recognition of. The most recent NHS staff survey reported really high levels of stress and burnout. We've got high vacancy rates, and we do have almost 20% of staff in the last survey suggesting they're already working paid overtime. So it will be interesting to see how much and how quickly they can unlock using staff overtime as a lever and a mechanism.
And Sarah, look, Wes Streeting has set out some quite clear dividing lines, and he said, look, let me be clear, we can't spend our way out of this Tory NHS crisis. We will beat the Tory backlog with a fully funded plan and a drive for reform that is going to need to be matched. If you want to understand my appetite for reform, think New Labour on steroids. What do you think that means, and how does that make you feel?
Well, I think that can be taken in a few different ways. So when I've heard Wes speak previously and other members of the Shadow Cabinet, I think there's been a recognition the last thing the NHS needs is wholesale reform. And we've just been through quite a bruising period of reform. We've got integrated care systems, quite frankly, still getting established and still bedding in. So I think reform may spook a few people, mention of that word. On the other hand, the sentiment that I hear, I suppose Wes expresses, public finances won't allow huge increases in spending in the health system. Therefore, we do need to invest wisely and reform where we can. So I think, Ayesha, it depends what they mean by the word reform. With reference to New Labour, I hear a pretty singular focus on bearing bearing down on waiting lists. That will be really welcome. However, what I think personally is, yes, we need to attack waiting lists. We also need to leave time and space and capacity to reimagine healthcare for the future. And that does mean a more preventative agenda. It does mean thinking about diagnosing conditions earlier and helping people manage so that they manage their health, manage living with more than one long-term condition so they don't need to end up in hospital. And it's whether there'll be capacity to do both of those things.
And I think that's a really interesting point, because you're absolutely right. From a sort of a retail offer point of view, cracking down on waiting lists, of course, is the absolute right thing to focus on. That's the thing that your everyday person is really, really worried about now. And that's the misery they're living through. But you're absolutely right, because focusing on public health and focusing on prevention and better sort of health is really important if you're going to, as you say, really not just reform the health service, but reform the health of the nation, which is what the Labour government should be wanting to do.
Absolutely that. We've got an ageing population. We've got more people living with more than one health condition. We know that we're not doing lots of the things we could and should do to particularly prevent perhaps unnecessary hospital treatment or unnecessary hospital admissions. So as one example, cardiovascular care and prevention, there's a huge opportunity to keep people well, help them manage their own health. And my worry is that if you go hell for leather on waiting times in a single parliamentary term, that's the signal you're sending to the health system. Focus on that singularly. And I worry that that will squeeze the capacity and the headspace to do other things. And if you remember, integrated care systems were born into this narrative, which is we've got to think more broadly about population health, preventative healthcare, helping to keep people well as we age, as we, quite frankly, live longer with many more health conditions.
For listeners who haven't engaged with the Byzantine complexity of the NHS structures over the last few years, integrated care systems were introduced a couple of years ago. They're kind of regional bodies, if you like, that are supposed to bring together hospitals, public health sitting within local authorities, charities and other sort of organisations working in the health sector together. I think the sense from people who I've spoken to who are working in them is that actually they've still been dominated by hospitals on the most part, though they are all different. And that's largely because of what you're saying. The government has panicked about waiting lists, understandably, because they are so high, and has made that the focus again. So they're getting a lot of top-down targets, which has not allowed them to do the kind of idea, which was to integrate and move more towards this kind of preventative system that you're talking about. Like, it is quite basic logic that if you stop people getting sick in the first place, then you don't need to spend as much on curing them. And people have been talking about preventative healthcare, certainly for as long as I've been working in policy, and it never happens. And in fact, every time you think it might be about to happen, more and more money has to get put into acute care in hospitals. Like, is it something just fundamentally structural in our system that makes it so difficult to make this shift happen?
We published a report a couple of months ago, Moving Care Closer to Home, which tried to address exactly this question. And so, the premise that we will move care closer to home, we will champion prevention. Successive governments, health secretaries have been saying this for at least 30 years, and it fundamentally hasn't really happened. And so we try to understand why. As ever, there's not a single reason, it's a range of reasons. But we don't really measure what happens in primary and community care as much as we do in acute care, and you tend to focus on what you measure. The status is quite different, i.e. primary care and community care doesn't have the status that acute care does. So you get a lot of people and energy sucked into the acute sector. The money has not followed various pronouncements that we will invest more in primary and community care. And actually the long-term plan said investment would differentially go more into primary and community care, and it hasn't. Partly COVID, but it hasn't. What we've seen is a swelling of the acute sector. So if we are serious about it, it is a hard nut to crack. We need to really align incentives and levers. We talk about moving the spotlight away from providers, away from acute care into the community. Of course, politically, that's much easier to say than it is to do.
We are in an election campaign, and of course waiting times is the thing that everybody is really focused on. Where are these extra hours going to come from in terms of doctors and nurses? The burnout, the structural burnout in the system. They also want to, recruit 8,500 new mental health professionals. How is this all going to happen, like on a practical level from a staffing point of view?
So I think as a first point, I think if you're serious about doing this and achieving this waiting times target within a parliament, you've got to quite quickly resolve industrial action and industrial disputes, point one. Point two, what Labour are saying is they would really look to have more weekend and evening appointments and slots and to pay people to do so. So over £1 billion in order to create more capacity. That does rely on existing NH staff fundamentally wanting to work extra. At the same time, you've got an NHS workforce plan that, as you say, is bringing in additional staff, it's training new people. That takes time to come on stream. It will be very welcome to the public. Whether they can, or how quickly they can unlock additional capacity, I think is pretty key to can they deliver this target within the first 5 years.
And things like the new mental health professionals, which again is something you hear a lot from people, a lot of parents really worried about the fact their children are on this huge waiting list. Where are these mental health professionals going to come from? Are they currently in training or are they just dormant?
Yeah, some of them are in training. And if you look at the workforce plan, there are clearly longer term plans to recruit and train more healthcare professionals across a range of disciplines. Various assessments have said recently the workforce plan assumptions are looking very punchy. So whether we can quite retain as many healthcare professionals as we are saying is a sort of $1 million question. I think the background noise of an NHS workforce which is tired, it's stressed, you've got lots of people reporting sort of unprofessional behaviour at work, you've got worries about retention. So I think some strong messaging from the next government about how much they value the NHS workforce, how they're committed to delivering the workforce plan is an absolute prerequisite for delivering some of the waiting time stuff.
Well, one of the challenges on staffing is that we've become very dependent on international staffing, non-EU staffing. I think more than 50% of the doctors and nurses we're now recruiting are from outside the EU. And there's a number of issues there. Firstly, obviously, immigration's a big political hot potato, and we've seen the current government trying to push down on numbers. But secondly, there's an international market for these people, and other countries haven't necessarily been overly dependent on the international market, are starting to recruit more and more as their healthcare needs also go up. How sustainable is this kind of international model, and what can we replace it with? Are we able to train enough doctors on our own without relying on international recruitment?
It's not sustainable. I've also heard people say quite recently we're just not seen as an attractive location in the way that perhaps we were a few years ago. Partly the immigration debate, partly pay. So we will have to grow more of our own. But I think this does play into the point about reimagining our healthcare system so that there is more of a focus on prevention, more of a focus on self-management, use of technology in order to help with some of this, because you look at the trends and it's scary. I don't think we can train the numbers of doctors, nurses and other healthcare professionals.
And it's even more true for social care, where actually there has just been, because of the changes the government made to the visa rules, just been a massive drop in the people coming in to work in the social care sector.
Look, a question that I'd quite like to hear from both of you actually is in terms of the retention of staff. We know that pay is a big part of that, and we've had so much industrial unrest over the last couple of years. How soon do you think an incoming Labour government, if they win, are going to have to address this issue?
I think across the public sector, they're going to have to deal with it straight away, because they're going to get the pay review boards coming back almost immediately. They're going to have to make a call on whether they accept the recommendations of those pay review boards, whether they think it's not generous enough, because the remits for those review boards would have been set by the current government. So it's going to be a big challenge, and it goes straight to the issue we've been talking about, since we started this podcast, which is that first budget, that first spending review, Rachel Reeves having to make an incredibly difficult set of decisions with a huge number of different priorities.
I also think it will send a very strong signal to the NHS if they can kind of get a grip of this and find a way with the junior doctors to resolve industrial action, that they are actually serious about meeting some of the targets that they're setting within the time frame. The mood is still pretty fractious, and it would go a long way to resolving some of what's quite sort of difficult, toxic conversations if they can find a way through it.
Can I ask about GPs? We haven't talked about primary care, and this is a huge issue for a lot of people, sort of being able to get a GP appointment. And unlike for hospitals, where demand actually hasn't gone up since the end of the pandemic, for GPs it has gone up a lot, and yet we have fewer GPs. So it feels like that's a real crunch point for the whole system.
Well, it's a great question, because I completely agree. It's really interesting. In the British Social Attitudes Survey this year, satisfaction with GPs has also plummeted to the lowest ever level. It's 34%. And previously, where satisfaction with the NHS has declined, satisfaction with GPs has held up. So it's absolutely what you hear people talking about day in, day out. I'm struggling to access GPs in a timely fashion. It's whether there's a quick term fix, I think is the difficult issue. Longer term, this differential investment into primary and community care, I think, has to be the way forward. I think shorter term, it is harder to fix some of the access issues very quickly. What we know is that current pledges on increasing numbers of GPs are not likely to be met. So that plays partly to training, but it also plays to retention. We've got lots of GPs saying they either don't want to work the hours that they were because of pressures, or that they want to leave the NHS. So some strong signals about how primary care can be a good and attractive and a well-resourced place to work, I think, is important.
And it's sort of worth noting that being a GP has now become a very dominantly female profession. I think about 70% of new GPs are women, and it's not necessarily a profession that's particularly well designed for women, particularly young women, to do if they want to start a family and so on. So there may be something there that can be looked at, given retention, as you say, is a serious issue.
And Sarah, what about this sort of recent development of people who are not quite GPs, but they've been brought in to help ease the burden and maybe do some more triage? What's the reality of how that works in real life?
Part of the reality is it's not that new. So you have had physician associates, as an example, and this has got particularly difficult in some quarters, working for many years in primary care and in other settings. I think there are fantastic examples of where you have lots of different healthcare professionals working well in a system or in a practice, in a GP practice. I think it's something that I feel very strongly about, partly because I used to run a patient-facing charity with a helpline. You need to talk people through the reality of this. It takes a while, for example, to understand you may not always need to speak to your GP. There may be somebody better placed to speak to you, but you've got to take patients and the public on that journey, because just phoning up and being told, you don't need to see the GP, I'm going to direct you to someone else, can clearly be quite worrying for some. So taking the public on a journey, which is, where you need to access a GP quickly, we want to make that happen, but where there's another healthcare professional who, may be able to help you quickly and appropriately, that's what we're going to do. I think we need to make sure that's communicated well and is well understood by the public.
We want to ask you one final question, which we've been asking to everyone this series. We're creating a sort of fantasy shadow cabinet for Keir, assuming he gets in. Who is going to be our health secretary in this fantasy cabinet? Can be anyone, real, fictional, historic.
Well, this is very left field, but I've just come back from the Hay Festival in Wales, and I took two of my children to see the children's author, Michael Morpurgo. He was brilliant at explaining Byzantine language or, complicated concepts very simply, applicable to the NHS. And he, he's a bit of a historian. And I think remembering the lessons of where we've managed to do things like bear down on waiting lists and the reality of what it's taken to do so, very apt for whoever forms next government.
A Child's Guide to Integrated Care Systems. I love it.
And next up, we're going to talk to Matthew Taylor, CEO of the NHS Confederation.
Welcome, Matthew. I wanted to ask a bit about the raw politics of how to make any of this sort of stuff happen that Labour are talking about in terms of the NHS and the pledges they're making about sort of getting waiting lists back down over the course of a parliament. You were in Tony Blair's number 10, you ran the policy unit. If you were going in to do a similar job in Keir Starmer's number 10, what would you be realistically thinking about was possible over the next sort of year, over the first year? What would you be trying to get people to focus on in number 10, in the Treasury, in the Department for Health?
I think I'd want to adopt, and as I understand it, I think this is probably how Labour wants to go about it, a kind of twin track approach, Sam. So I would want to be talking about early wins. What are the things that we can do reasonably quickly that will form in the public's mind the idea that when Labour came in, things started to get better. But then I would also recognise that as people as distinguished as Chris Whitty have recognised, there is a fundamental unsustainability to the way in which we organise our health and care system at the moment, and therefore that I need to be working up a new, pretty transformative plan for the health service. So that's why I would go about it. I would say, what can we achieve now on the fairly shaky foundations we've got, but then how do we go about rebuilding those foundations? And
before we get onto the sort of bigger picture, what kind of early wins are available, given lack of money available, given how difficult it is to make anything happen in such a big system? What can you do quickly?
I think you can make progress, and this is probably why Wes has chosen it. It's also something the public understand most, but you probably can make some wins on waiting lists. Waiting lists have stabilised over the last few months. Obviously, LB is going to have to resolve the industrial disputes somehow. That's going to be urgent, because if those go on, that will be a spanner in the works. I mean, it's not true. I don't think the Prime Minister tends to say that the waiting list would have plunged if it hadn't been for the industrial action. That's not the case, but they would have fallen a little bit more quickly, which is it would still take many, many years at current trajectories to get anywhere near where we were a few years ago. So he's got to deal with the industrial action. But, it is simply the case that if you are willing to pay people extra to work evenings and weekends, and you invest a bit of money in the kind of kit that they need, you will make progress as long as there isn't industrial action. So they can probably accelerate that. They can probably reduce the number of people waiting over a year. They can almost certainly get rid of almost everybody waiting over 65 weeks. So that is not a bad choice. Because in a sense, health is a very complex system, as you know. Electives are one of the simpler issues in a very complicated system. I mean, if Labour was saying they could make progress on urgent emergency care in short order, I'd be quite sceptical about that, because that's a much more complex. The feedback loops are much more complex.
We've now been told there's going to be a junior doctor strike just before the date of the election itself, which is obviously an attempt to get back into the papers. These sort of strikes have been happening without very much attention for quite a while now, after the initial burst of attention. How difficult do you think it will be to reach resolution? Are we at the point where the BMA and the junior doctors are actually pretty keen to get this sorted and are just kind of waiting for a new government to sit down and have a conversation with them? Or are they going to continue to play hardball with a new government?
It's difficult to say, because, to an extent it reflects the politics of the BMA. I think those are quite kind of challenging politics, I suspect. I do think that what Wes has been saying today on this is the right thing to say, which is, look, don't imagine that a Labour government's going to come in and give you 35%, but also recognising, as Wes has done today, as Wes Streeting has done today, which is it's not just about pay. It's about working hours, it's about training, it's about a more sensitive approach to people's personal circumstances. So I suspect that what Wes Streeting will be wanting to say to the unions is a bit like what I said earlier, which is, look, let's find a way to get through this, but I do want to address the bigger issues, and I will address those bigger issues, but let's not sour things right at the beginning. And I suspect the trade unions, the BMA in particular, will want to try to get into that kind of positive mindset. Now, how long will it last? That's the question. So I suspect things will get better. I suspect Labour will find a way of being able to avoid further industrial action, but that goodwill will not last very long.
Let's move on to the bigger picture, the sort of longer term. That this is the kind of early challenges Labour will face. But then you've sort of said, okay, we need a bigger, more structural, more fundamental reform. One of these sort of interesting things I find talking to people working in the health policy world is there's simultaneously a desire not to restructure again, because we've had so many restructures over the last 20 years or so, and also a belief that you do need to do something really quite fundamentally different to what we're doing at the moment in order to sort of deliver on this promise of moving towards more preventative care and so on. How do you square those two things? How do you get a fundamental change without changing the structures that we're operating in?
No, I think it's a really good point. So the reason people don't want to restructure is that it is a weapon of mass distraction, and we know what happened with the land survey reforms. I'm old enough to remember Frank Dobson coming in and ripping up GP fund holding when probably it would have been better simply to have reformed it, adjusted it in various ways. It didn't need to be pulled up by the roots. So then I think Labour promised in 1997 to abolish the internal market and then obviously recreated an even more kind of a marketised system a few years later. It's important that we don't have a reorganisation for organisation's sake. But the two things that we have got to address is firstly, what do we do about the health of the population? The kind of point that Chris Whitty will make is if we are not able to keep people healthier for longer, our health service is simply not sustainable. And keeping people healthier for longer does require action in the health service, but it also requires action in all sorts of other domains. And so this goes to Labour's idea of a mission, a broader approach to health. Only estimated around 20% of our health outcomes are a reflection of our interactions with the health service. The other 80% is a combination of genetics, but then also what I call the social determinants of health, poverty and housing and environment, and then lifestyle, smoking, alcohol, food, gambling, etc. So first of all, we need a health policy, not just an NHS policy, and that health policy needs to be really firmly focused on how do we improve the nation's health and how do we keep people healthier for longer. And then the second thing we have to do is something we've been talking about for decades and actually we've done the reverse. And that is for decades we've been saying we need to move resources proportionally out of the acute sector and upstream into primary, into care based in the community, into secondary prevention. But actually what we've done over the last few years is increase the resource going into acute. We've got fewer full-time equivalent GPs and we've got an awful lot more. Well, I don't need to tell you this. You've written about it very eloquently. We've got more people, more doctors in hospitals. So those are the two things we've got to try to find a way through. And it's not, I know that when I talk about this stuff, people go, oh God, there's your kind of lefty think tank. It's all very abstract. It really isn't abstract. If we do not do something to get people to live longer, healthier lives, and we don't do something to shift the pattern of investment in the health service, then we are going to end up in a situation where the health service just consumes, more and more of public spending and more of the workforce.
So in terms of trying to develop like a proper health service as opposed to a sickness service, which it feels like we've got at the moment, I totally agree with joining up the dots. But that work is really time consuming. It's not the kind of sexy end of politics. It takes quite a long time to sort of see developments on that. How would you get that to work in real life from a sort of government delivery point of view? Is that something that needs to be driven from the centre? Does there need to be some sort of coordinating, kind of cross-cutting cabinet group? How does this work in real life?
One problem about the election being called early is that I think that Labour was really starting to focus on this question of mission delivery, and it's kind of had the rug pulled out from under its feet in terms of its preparedness for that. So I suspect that thinking through what mission-driven government is going to be something that's going to be a priority for Labour. And I'm certainly sure that civil servants are doing a lot of thinking about how that works. And, there's a lot of evidence from around the world around this kind of mission-driven government. And, it's not easy. There are examples, there are areas where it has been done, and probably the environmental agenda, the green agenda is where it's been most often done in other countries. So there are things to be learned there. So there is going to it's going to be a lot of work that has to be done on how you make that work. But then more specifically, I guess I'd say two things. One is let's not be too pessimistic about this. We reduced teenage pregnancy by a half. We have reduced the prevalence of smoking by, I don't know what the figures are, but, from over 50% to less than 15%. We took lead out of petrol pretty quickly. There are things that we can do that will have relatively quick feedbacks if we decide that. So I think a government that was really concerted in its determination to tackle obesity and had a 10-year plan which encompassed everything from the regulation of food products through to investment in fitness, in schools, all sorts of stuff, and actually using the new drugs that are coming along, which will make a difference as well. I really do think you can make an impact. So it's partly about focus. And then finally, I think in terms of the health service, it's just being clear where the easy wins are. Areas like vaccination, like the diagnosis and treatment of cardiovascular disease, where a more concerted national approach, I think vaccination, it saves £24 for every pound that's spent on vaccination. So there are some areas where it's just obvious that if you could invest more reasonably quickly, it would have a relatively quick feedback loop.
And just picking up on what you said there about food regulation and obesity, because I think this is really interesting. This could be an area which wouldn't cost the Labour Party a huge amount of money. It sends a big signal. It's, of course, very controversial. But do you think that's an area that a future Labour government should get stuck into quite quickly, whether it's prescribing what goes into food in terms of, reducing salt, sugar, fat, etc., and very tough new measures on advertising and chicken shops and all of that? Is that something Labour should get stuck into?
Yeah, no, absolutely. And I think that when they do, I would recommend that I'd recommend they listen to one of the best programmes. I always recommend it to people. You can't get it on the BBC Sounds anymore, but there was a wonderful series called Who Done It that Michael Blossom put together on what happened to teenage pregnancy. I don't know if you've heard that, but it's great. He looks what happened. Nobody thought teenage pregnancy was going to fall, and then it really did fall. And why was it? And he comes to the conclusion that it was a mixture of government strategy, long-term contraception, social media, and Vicky Pollard from Little Britain making teenage pregnancy, kind of stigmatizing it, making it unfashionable. I mean, it's a wonderful mixture. But actually, if you think about obesity, if you were going to crack it, it's probably going to be the same combination. It's going to be regulation of food. It's going to be investment in fitness and, maybe taking that more seriously in schools. Yes, it might be a shift in social attitude so that people start to see obesity as a problem, not to blame people, but to recognize that we collectively want to support people and help people. My sister-in-law was told that she had to go on a very severe diet to avoid type 2 diabetes. She drank nothing but soup for 9 weeks. It's completely changed her life. She's incredibly fit, incredibly happy.
How happy is she really, though, Matthew?
Yeah, she really is. But what's interesting is that I asked her at the end of it, I said, if you were asked to coach 3 people going through what you've gone through, would you do it? And she said, I'd love to do it because it was so hard, but I've been through it. And I'm not I'm not a doctor or anything. I'm an ordinary person. So we could tackle obesity, but it will require a similar combination of 5 or 6 things all happening at the same time, which gets you to this point. And once you've got to that point, then the thing can start to move reasonably quickly.
One of the things I find interesting about these kind of questions of public health is we're completely inconsistent on them. As a country, the government has been completely inconsistent. So you get this sort of idea of a meat tax, and this is sort of panic, and this is the worst idea ever, and everyone's being mocked for it. And then you also have the government trying to completely ban smoking. On one hand, it's nanny state. On the other hand, it's a sensible and the right approach. They seem to have taken both approaches simultaneously on different issues. Is there any way we could just sort of have a better framework almost for thinking about what is the state's job when it comes to public health? What is acceptable? And how do you get public consent for those things to show that it is actually something that people want, rather than endlessly being stuck in nanny state versus libertarian arguments every time we go around one of these discussions?
I should be clear. I run a charity, and we are responding to and engaging with all the political parties. I do think, however, that you're right in the sense that it has felt for this government, potentially because of its ideological position, it has often felt conflicted between, in a sense, the duty of kind of public care and responsibility and the need to do things which reduce burdens on the state and the taxpayer, and that kind of more libertarian dislike of nanny state, and that has led to inconsistency. I suspect Labour will be less, if Labour wins, they'll be less affected by that. I think they will probably feel more unapologetic about, and Wes Streeting has indeed said, hasn't he, that he's not afraid of being referred to as the nanny state. I think an important part of this, however, is the way you articulate the narrative. I know that I was in Number 10 when we introduced the ban on smoking in public places, and it was absolutely clear to me the critical thing there was the evidence for passive smoking. The point at which you could say, look, it's up to you if you want to kill yourself, but you can't kill other people, was a critical moment in terms of shifting the public view of that issue. And that's why that change could happen. So the way you construct this narrative is important. And part of that narrative, I think, is about the impact on the economy of the state of public health. And I think that's something that a government that is deeply committed to growth, what is the number one thing that Labour talks about every single day is growth? Well, it is clear that one of the things that's holding back growth is the health of the population and the access to health and care services that they have. And that, I know, is one of the things I'll be listening out for in terms of, if Labour does win the election, in terms of what Rachel Reeves says, is are we going to see a greater recognition of the interdependence between health and the economy?
Yeah, I think that's such an important point. I mean, something I've often wondered about as well, you mentioned kind of, activity at school, but I often wonder if more should be made of a partnership with employers as well, about how employers have got skin in the game in terms of their workforce being healthy. Should employers be incentivized or persuaded or encouraged to offer sort of more healthy living to their employees, whether it's exercise classes or, healthy food? What do you think about that?
Yeah, I think with large employers, you're pushing an open door, and I certainly think more can be done there. There's a large retailer, for example, that gives its staff time off for cancer checks. So there is quite a lot of this stuff happening. And actually, my organisation, the Confederation, is exploring more how we can work with businesses. The challenge, as you know, in these areas is always small and medium-sized businesses that don't have so much capacity, the tighter margins. So you need to make sure that you're not just doing this with big employers that care a lot about their reputation, have got economies of scale, but what can you do for the rest of the economy, for people, including, of course, people working in areas like social care, where you're working in low-wage areas, quite atomized in terms of employment. So, yes, I do think there's a lot more employers can do. I think large employers want to do more, and some of them already are, but we do need to think about what we do for all of the workforce.
So, Matthew, we'd like to hear from you. If you could pick somebody to enter your fantasy cabinet, it could be somebody dead, alive, historical, fictional, whoever, who would you choose?
I think I'd choose Chris Whitty, and the reason I would choose him is because if you listen very carefully to what Chris Whitty is saying, he is saying that the present way in which we do things is unsustainable and it needs a radical change. He says it in a very Chris Whitty kind of way, but he has got it. And I think that that's the thing that we most need, is a recognition that without major shifts in the way we improve public health, major shifts in the way we invest money in the health service, we are going to run out of road.
Great choice. I saw him give a presentation at a conference recently, and it was one of the best bits of small p political communication I've ever seen. He's very, very impressive.
I was sitting about 10 metres from you, Sam.
Well, I hope you enjoyed that. And if you are not a member of the Para Test crew, you can head to the paratest.co.uk or the paratest.substack.com. You'll get episodes ad-free and early before anyone else. And there's also an exclusive chance to be part of the podcast and lots more. Also, do get involved with us. If you've got any questions or comments or ideas you'd like us to explore, we'd love to hear from you. You can email us on pod@theparatest.co.uk. You can also get involved on social media as well.
And we've also got our brand new YouTube channel, which is Power Test Pod, and you can find clips on there. The Power Test only exists because of the amazing support from you, our members, and our supporters. And we're also delighted to have the backing of some brilliant organisations like the Future Governance Forum, which is providing intellectual and practical infrastructure vital to the revival of progressive government in the UK, and the Centre for Progressive Policy, a think tank championing inclusive economic growth. We're also really glad to have support from the Institute for Global Change, who provide us with exceptional research and briefings, and also partner with a fantastic Labour list, bringing to life many of the issues, themes and discussions we're covering on the pod.
One size fits all seems like a good idea for clothes until you try them on. Same goes for healthcare. That's why United Healthcare offers flexible, budget-friendly coverage for medical, vision, dental, and more. Learn more at uh1.com.
Need new glasses or want a fresh new style? Warby Parker has you covered. Glasses start at just $95, including anti-reflective, scratch-resistant prescription lenses that block 100% of UV rays. Every frame's designed in-house with a huge selection of styles for every face shape. And with Warby Parker's free home try-on program, you can order 5 pairs to try at home for free. Shipping is free both ways, too. Go to warbyparker.com/covered to try 5 pairs of frames at home for free. warbyparker.com/covered.
The living room is where you make life's most beautiful memories. But your sofa shouldn't be the one remembering them. The new life-resistant, high-performance furniture collection from Ashley is designed to withstand all the spills, slip-ups, and muddy paws that come with the best parts of life. Ashley high-performance sofas and recliners are soft, on-trend, and easy to clean. Shop the high-performance furniture in-store or online at ashley.com. Ashley, for the love of home.